Well, Kentucky leaders are now joining parents in demanding answers after children with autism, with Down syndrome, unexpectedly lost Medicaid services. Wave News reporter Logan Perrone's been on top of the story for us for weeks now and shares some new details tonight.
Yeah, Brian, yesterday State Auditor Allison Ball announced that her office has requested information on the denials. It comes as those families wait to learn exactly how this happened. Weeks after families across Kentucky were surprised to see their children denied the renewal of their Medicaid coverage, those impacted are asking questions.
For me, my priority is to find out why this happened.
Trina Martin is one of those parents. CHFS reinstated 112 of the 151 youth waivers they reassessed, including her 9-year-old daughter Ellie's. Nearly all of those were children with autism and/or Down syndrome.
All of us families felt like our kids were targeted. That really pushed me harder to fight, to dig in and get more information and see what happened.
Trina is still waiting for public records to be provided to her and still does not know exactly how the denials happened. She's not the only one who wants answers. In a letter to the head of CHFS Tuesday, Kentucky Auditor Allison Ball's office asked the cabinet for specific factors or events that led to the denials. The office also asked how the cabinet plans to prevent this mistake from happening again.
She is really wanting accountability for what happened.
Wave News has also pushed for answers. On June 11th, CHFS told me concerns about the interpretation of annual reviews have been addressed with the subcontractor. I asked for clarification on that statement on June 17th. Cabinet officials sent me a statement Wednesday that reads in part, "We began a review of the cases and found that a subcontractor was not correctly examining the Medicaid criteria used to determine if someone requires long-term care services. We then required the subcontractor to take action and correct their error."
Yeah.
The statement never specified if that error was made intentionally or by mistake. It's a possibility parents like Trina have wondered and worried over.
Our thought is that it was maybe not an error, that it was an intentional thing because of the way it happened.
Trina says she's glad the auditor is taking action and hopes families won't have to take up this fight again.
This is definitely something that everyone's taking seriously now, and I am still ready to keep going full force and do what we have to do to get through this.
Now, this nightmare scenario for Martin and the other parents was followed by the announcement of a proposed new Medicaid waiver. CHFS is taking public input right now on the proposed Community Health for Improved Lives and Development, or CHILD 1915C waiver aimed to serve children and youth until the age of 21. However, Martin says the new waiver does not allow for participant-directed services, or PDS, that allow families more flexibility in the choice of their support services. Links to the public comment period can be found with this story on our website. Logan Perrone, Wave News.